Ngut kibor bahakhmat pyniaid ya Nazareth Hospital kiba kynthup ya Rev Sister Noreen Administrator, Dr G Rangad Chief Medical Officer, bad Dr Frankie Shadap Siangshai. Haka arpuitarik Nailar kila pynbna baka Nazareth Hospital Laitumkhrah mynta kala pyndonkam daki kor kibor bad ki rukom Puid Budlum Bathymmai kiba duna ke jinglut kiba donkam bansa bun sngi ha hospital bad kiba duna shibun ke jingpang jingjhia haka met phad jong nongshah puid. Yakani ke Jingstad Puid Budlum bad ki kor kibor Bathymmai la tip kerteng kum ka Endoscopic Surgery. Kabaki nongpang kila banit pai no shala yeng tang hapo shisngi bala pendep ya ke jing sumar yaki. Ke jing puid ru kalong kabaret kum baju long haki jing puid ki bala jule baro shikata haki snam bala no. Kani ka rukom sumar Bathymmai ka penstat ban yo jingkot bat day ban ting ne her serniu yaka kila ong.
News channel nakarteng junga kadi Dr Frankie Shadap Siangshai ngalatrin ledi haka super specialty ko ong neurosurgery naka hospital ba bokot sadar jong hospital po Delhi o sna majar khatra tak benongkong nongshah ngako pan ai kubli hi administrator jungi bade Sister Noreen balung ba kijing kershan jungi ngilala ban poi hakani ka khep mangila ban terwa kijing sumar ki bakham pher namta ki brio jungi ki ba hakani kana hakani ka sor jungi wat hakani ka jilla jungi hi borok khawai kata korkom sumar jing sumar surgery ka ba mynta kare shphang jong budlum kata ka bros kata ka jing sumar budlum kala dei be lingba kata ka jing puid ka badei daki ba ka bengi ong ka micro surgery bros kata ngaru iladi ngale kum kata hi surgery hakani hospital henry hakni kisnem ki bladap kila don khamtam ui patient ibla one request yang bangin le ya kata endoscopic spine surgery tangba kubsung si kolong baha to kopor himpat don kitiar pangimpat don kilat panle kata ka surgery hangni hadin nang tapat na le training iladi na kanya na kubenta kani ka surgery pada ka jingkershan jong hospital mentang ilala wansang benterwa ya kata ka rukom surgery hakani ka hospital jungi bat kalong ka ike ka basngo sarong ban ong ba ngilong ki banengkong hakani ka jilla Meghalaya pamdei hi thrai tang ka jilla Meghalaya wat hapo ka hati ru kimpadon ki bale kani ka surgery kemak phiong ba kaya pher yu kata ka surgery ka bangile menta manak bare bos kata hot ka jing bentoy kalong ka ju hi ka de ka surgery khamtam na ka menta ki bangi ong kata ka jingpang slip disc ka baar kalong ka canal stenosis kabalai kalong ka spondylolisthesis kita di baro hot ki jing shitom ka jong budlum ngasidon ki dor khindiat mansubatai phi ki pher yu hakata korkom sumar jungi boros kata da PE ngakarmen PE kani kadi ka jing he jong kata kar kompu jungi na kabenta ka bangi pu yunu nu budlum par kani kar kom sumar kalong ka ba da prakhat hot ka yo jung mentoy ki brio ngabang bam den jung mentoy henrei kalong ka surgery ka bakhamlong tomet na kabenta kamet na maring haban pu ya ka sni do kham he yaki dok sa ngi haban weng yaki shieng ri haban weng khang ban yo poi sha uta u slip disc bangi ong bangi yo ban se yo ta henrei menta lengba kani ka surgery mai ka bangi le ka bangi ong ka minimal invasive spine surgery pot ka kerteng ka bapaka kalong ka unilateral biportal endoscopic surgery PE ba katno ka jingya pher hapreng kini ki artli ki surgery ba katno ka jingya pher jong ka jing he jong kita ki jing puid kani di ka ba menta ka baskadiang junga ka di ka ba menta ba kani di ka barim bat hadian badap sumar ki jing puid uk kilong tangkat ini I size na ka menta ki brio tamda ka jing pentoy kalong ba habang puid ki ba ki baret ka jing pentoy jong nongpang uk kabun ka benengkong kalong ka jingpang ka khamduna ka baar kalong bangin yo bangin pha no ki patient sha yeng ru ka kham kloi ka balai kalong ka jing mong na ka menta ka domet ka doksa ki shieng ru ka duna bha ki briuru bikin yo ban bikin ke lik phai biang se ka jing em ba kiju im ka kham kloi kham tam le na ka menta ki briu ki ba khamlong active kum ha ki sport na ki kap yele ka hi kam ayu ka kloi bha ya ki lik phai biang se ki ni ka jing em juki ngatermen bale se nang ne shakmat baki breu kinyo mentoy lengba ini jing dongba ini jing sumar jungi bangi lastang hang ni ma kermen ki breu kin one shakmat baki nam tieng kamlong sho ka surgery ko bakum menshwa ka bangi hap ba pihak bansa hospital de kisngi kini ki hos ki surgery bementa pihak bansa tang khanjat sngi ar ne lai sngi but playo ni phashi
I am Dr. Jingstad Puid Budlum. I have been working here since 2004. So I just wanted to highlight some procedures. Probably we in Nazareth Hospital started the advanced laparoscopic surgery cases way back from around 2010. We have been started the advanced cases here in Meghalaya, I can say, as a first to do all those procedures. Now we are doing the commonest procedures: laparoscopic minimally access surgery, gallbladder operations, one of the most common. Patient can come in the morning, get operated and go away in the evening. They can go easily by evening, they can be discharged. We are doing cases, operations under spinal anesthesia. Where there is risk for general anesthesia, we can do those under thoracic spinal anesthesia. Patient can watch the operation during while we are operating. We are the one who started advanced laparoscopic surgery here, mostly cancer surgeries like esophagus, stomach, colon and rectum. We have been doing it for last 10 years with good results. Patients are very happy because of small incisions, less pain and early recovery. We have been doing solid organ operations here like pancreas, liver, laparoscopically, minimally access surgery. And we have started also over last 4 years gasless laparoscopy, where we don't give gas in some cases where gas may be cause some complications. In those cases we can do laparoscopic gallbladder operation, appendix operation and some ovarian surgery without the use of gas. That is the gasless surgery. We have started it here.
I'm happy to announce that Nazareth Hospital started a significant journey in our laparoscopic surgery, especially starting with endoscopic spine surgery, one of the first hospitals started in Northeast, and also many advanced laparoscopy surgeries done by our surgeons. I also thank our committed and dedicated hospital staff, especially all our doctors and the nurses and all the staff who are working in this hospital with a lot of dedication and commitment. And with the MHAS and Ayushman Bharat scheme, people are benefiting quite a lot from the hospital. Many of them need not pay anything for some of the surgery, some of the treatment is done in the hospital. So we are also thank the government for providing this scheme for the benefit of the patients. So I also take this opportunity to thank our Dr. G Rangad, Dr. Frankie, who are doing lot of surgeries in this hospital, and also all our staff. Thank you.